Hello, everyone. Welcome to our second presentation this month. Today, we will be discussing women and heart health, and this all falls under the CREP initiative. CREP stands for Community Resource Education Program, and today we'll be bringing awareness to Heart Health Month while also the celebration of Black History Month. My name is Alexa Finnerty, and I am a student ambassador at Community Engagement and Consultation Group located in Maryland. And then do we want to show the slides now?
Sure, Alexa, I will show the slides.
So as I mentioned, today we'll be going over women and heart disease. This is our second discussion this month, and our objectives for today are how to prevent heart disease as the leading cause of premature death among women, and then also going over heart disease signs and symptoms that we should all be aware of. So without further ado, I'm going to pass it over to one of our presenters, Dr. Mwalui, and she will give us the overview of heart disease.
Thank you, Alexa. By the way, you're doing a great job. We just started. Thank you, everyone, for joining us. My name is, I'm Dr. Mwalui. I'm the CEO and founder of Community Engagement and Consultation Group, and I'm happy to be here. As Alexa mentioned, this is our second for this month, and next one is next week. So let's just have a look at the overview of heart disease. What are those statistics? If you haven't lately visited the CDC website or the Office of Minority Health website, please do so because the numbers are really disturbing. So African-American women are nearly 60% more likely to have high blood pressure as compared to non-Hispanic white women. And this source is directly from the Office of Minority Health. So let me also introduce our guest speaker, and that's going to be Chelsey Davenport. So Chelsey is a wellness coordinator and a dear friend of mine. We sit on the same board, on the same committee, the National Wellness Institute. This includes, the work that she does in Missouri. Her background is in the wellness management, where she earned her degree from Pittsburgh State University. Chelsey, welcome.
Thank you. Glad to be here.
So I'm going to start it off with a question for Dr. Mwalui. In the most developed country, the United States, on the planet, why is there still such a problem? And how do we continue advocating for different preventative measures?
Alexa, that's a great question. And those are the questions that, we ask ourselves all the time. Why do we still have this problem? Why is it that this is the most developed country on the planet with a great infrastructure in healthcare? Yet we're seeing more and more numbers of people dying prematurely from heart disease. And these are African-American women, women of color, minority women. There's so many reasons for this. And as we go through this workshop, we will also tackle a few things that are contributing factors to this issue. But I'll tell you one thing. A lot of these issues are controllable. However, we still have a lot of issues from way back from the historical making of our policies.
Yeah. And then Chelsey, for you, in your line of work, what do you see and how can we help our communities and our audience today understand that heart disease can happen to anyone?
Being a wellness coordinator and overseeing over 700 staff, most of them predominantly in education in my school district are women, the preventative key is the biggest deal. Being aware, education. So having the accessible resources within the communities, whether it be from your wellness coordinator in your district, or whether it be from your doctor, and actually being comfortable going to your doctor to ask these questions. So I would say, just having accessibility, that's the biggest thing to understanding these diseases that are targeting specifically women of color. And I strongly do believe that as we get older, and I can mention this a little later, we deal with aging with our bodies, and women have menopause. And so when you think about this, as our bodies are functioning wonderfully when we're in our younger years, and as we get older, things start to decline. And estrogen is a huge part of this. And so, estrogen makes everything feel good. And then as we get older, things do decline. And so estrogen starts to deplete in our bodies. And so then that puts a lot of strain on our different organs, and our heart, unfortunately, is one of the ones that takes the big impact of that. So just knowing these small things that as we get older, to tap into and just have more understanding of what is going on with our bodies itself.
Yeah. So kind of to go along with that, if any of you want to add what needs to be understood about different signs and symptoms, because we do hear a lot that a lot of heart disease problems are silent. So what should people be aware of?
I'll tell you this. Okay, so I guess we have one of our audience members, who was great. That's why we're here. Put it in the chat, raise your hand, and we'll take it from there. Yes, hypertension. One person say hypertension, but let me just also say one thing. There's also a myth, right? And this is also a reason why we need to understand heart disease. There's a myth. The myth is heart disease does not affect women who are fit. And the good thing is we do have our one and only Chelsey, who's a wellness coordinator. So when we hear this, heart disease does not affect women who are fit, what does that tell us? And what do we need to raise awareness to?
I'll first start off by, there's three factors if you think about it. We have your behavior, we have your environmental, and then we have that beautiful thing called genetics. So that it's really hard to run away from that genetic component. And I will say this, that behavior is huge. How we treat ourselves is huge. What we put in our bodies, how much exercise we get is huge. Our environmental, what is accessible? Are gyms accessible? Are healthy walking paths accessible? Are biking paths accessible? Those things play a big, big role in that. But I would say if you are going to your doctor regularly, these things will come up. If you're experiencing maybe not feeling yourself for feeling yourself right for a couple of months, going in and finding out, could it be your heart? And it's always better to know than not to know, because if we find out in an early amount of time, then you can fix that, or you can make it better, or perhaps find ways to, if you have something going on, ways to make that better. But knowing is better than not knowing. And then I will tap into that genetic component, which, you always hear, oh, well, I'm just genetically predisposed. Well, okay. I feel like we all are genetically predisposed for something. However, all of our bodies are set in motion. What triggers those things is how we treat our bodies. So let's say high blood pressure or heart disease runs in my family. I will trigger that if I don't treat my body right. It's there. It's brewing, but it's how I treat my body and what I'm exposed to can trigger those. We all have those things that trigger in our body. Sometimes that happens later in life, sometimes early, but we're all human. And so things do happen, and you can do your best, but sometimes things just happen. So heart disease, you can run from it as much as you want, but sometimes it's just part of our makeup, but we can do as much as we can to prolong that, prolong the inevitable, as I say.
Yeah. Thank you, Chelsey. And one of our audience member mentioned, high blood pressure. The one thing also that, I want also to discuss is we don't want to know. We don't want to be associated with something that's going to kill us. So one of the things that, I always talk about, me being a Black woman as well, is cholesterol. Chelsea, you mentioned as we age too, our metabolism also, declines. So cholesterol is one of those things that we need to pay attention to as well. As a matter of fact, the American Heart Association recommends that we start getting our cholesterol checkups at the age of 20. But you ask yourself, how many people do that? How many people literally sincerely go to the doctor and ask, can you check my cholesterol? Right? How many people do that? Not as many people do that. Unless if you already know your family history of what's going on, what you have. But again, not as many people know their family history. And in addition to that, there's also this myth, I don't have symptoms. What does that mean? I don't have symptoms. Of course, symptoms will not show up in front of your face, but symptoms exist. So if I was to ask you, Chelsea, what do people need to know about symptoms, heart disease symptoms?
Well, I would say the first thing is, like you just touched on, is family history. If you do know that your parents or your grandparents had this disease or are dealing with it, it doesn't fall far from the tree. It's a cycle, So I would say that obviously high blood pressure, hypertension, cholesterol, and those are, if you do go to the doctor and you do get these tests done, those are simple tests that they can run right away. And so that if you can find out where you are with those, then they can the doctor can kind of let you know like what your options are to get those under control. I will say, paying attention to heart arrhythmia too, and I'm sure we'll get into that later when we talk about COVID-19. But how your body feels like with your heart, if it's accelerating too much and you feel like you're out of breath, these are certain signs that are just light, but if they're consistent, it's a concern.
Yeah. And I totally agree. I think, the other confusing thing when it comes to educating, our audiences, even community members, is not really being able to differentiate between signs and symptoms. That's one of also the hardest things. Now, let me just give you a little bit of statistics here. 64% of women who die suddenly of coronary artery disease, right, had no previous symptoms. Okay? But because these symptoms vary greatly between men and women, they are often misunderstood. And that's why, I brought in the difference between signs and symptoms. A lot of people don't even know what that is, right? And that's why let me just take it back. Here at CECG, Community Engagement and Consultation Group, what we do is we always ask folks, when you go to your doctor, make sure that whatever number they give you, you ask, what does that number mean? What is the normal number? Now, compared to the numbers that you're giving me and the normal numbers, scientific normal numbers, what should I look out to? What should I look out for? So that's why it's important to really understand what these numbers mean. All right. I guess we have to move on to the next slide.
Thank you guys both for those answers. I guess now we'll get into what you guys can tell us about medical bias and diagnosis within heart disease.
Chelsea, do you wanna go on that? The medical biases?
This can be really tricky. And that's why, I know a lot of people are apprehensive of going to a doctor in general, because for one, you want them to identify who you are. Okay. They have to be culturally aware of differences that your body could be going through versus someone who doesn't look like you or someone who doesn't have the family history. Everybody doesn't need to be put in a box. So when you go to your doctor, you want to make sure that you feel like you are heard, because you are different from the next person. Okay. I know some people like to lump everybody just because you look the same. You are not the same, right? So having a culturally sensitive doctor understand your differences, maybe even a doctor that is more keen on worldviews, you know what I mean? So that they can understand where you're coming from when you walk in that door so that you feel comfortable, because you're not going to be able to communicate and open up to the doctor about how you're feeling if they are not relatable, hands down. So I feel like that's why sometimes people don't go to the doctor, because they don't feel like they would understand them or feel like they're heard.
Yeah, as you said, Chelsey, medical biases, it's a very difficult conversation to have. Oh, I would say I had a very hard question to ask. Now, what we have seen in the past, and these are from either lived experiences or even just reading literature about it, there's a lot of biases, different types of biases, and we'll go through some of those biases. But, for those, and the good thing is this is what Black History Month. So, what's the best place to talk about, these biases and this time of the year? So biases come in very different forms. Even we as humans, we have our own unconscious biases that we are not aware of. And, again, bringing it back to our organization is we are very culturally sensitive when it comes to certain things. We are aware, and we go all the way out and talk about this. And I just hope and wish that all medical institutions really talk about biases, because that's where we find a lot of misdiagnosis, mistrust that also erupts from people being either discriminated against because that provider already presenting himself with the biases. Now, let me go through some of the biases that I've come across, or that I have actually been in discussion with. So we have the anchoring bias. The anchoring bias is an implicit reference point of the first data. So when we look at some of the data, and this is what the data says, that people of color are reluctant to going to the doctor because of X, Y, Z. That's already, without you as a provider actually looking at the data, but just reading the data, right? That's already a bias, right? Then we have the framing bias. The framing bias, is a favors based on the presentation of information in a negative or positive context, right? So you think about that. What is that framing bias? What does that tell us? Especially, when it comes to diagnoses, right? There's misinformation that comes with that. And especially, again, we'll talk about COVID and heart disease, how it has affected that. So the biases, whether we like it or not, exist. Personally, I have so many stories to tell, but this is not a place for those stories to tell. And I've heard a lot of stories from people who actually have shared some of their lived experience going to a doctor and just seeing them or telling the emergency room physician that I'm in pain. But if you are not the type of person who literally exhibit and, overly show that you're in pain, then they'll think you are making up stories, right? So then you start wondering, how do you know who is really sick and who is not really sick? But just because of what you already know, already have, already you perceive, that is going to play into how you're going to treat the client or the patient. So there's a lot of situations that we've had, either on the news, from our friends, our own personal lived experiences that we can go on and on and on and share. And that's why we see that, there's a lot of, preventable things that could be prevented, but people end up dying, especially heart disease. And then we also find that because of these biases, people don't want to go to see their providers, or they would rather find a provider that looks just like them. And here in our organization, we're also fortunate to have partnered up with the Black Physician Network, which was created about 2 years ago to specifically address some of the issues that we are discussing. Because some studies have found that people are reluctant to go to the provider who doesn't look like them because they will not understand them. Right? They will not understand them. So we as advocates, as educators, then what do we do? What do we do? And by the way, feel free to put or any kind of comments in the chat or raise your hand, so we can have these conversations, because some of these conversations are very difficult to have. Chelsey, do you want to add on to that?
Not really, just it's easier said than done, but taking control of yourself, by going into the doctor and telling them, I know that I something is not right. I mean, you're the only person that knows how you feel. So always remembering that, you want to take the time now to take care of yourself, or you will be forced to take care of yourself later when it's not good, So if you're not feeling well and the doctor is not giving you the right answers, you keep persistence. Persistence is a big deal too when you're trying to find out if you have something going on within your body too.
Yep, and I agree. And the other thing that I can also add on to that is it's all right to find another doctor. If you're not comfortable with that doctor, it's okay. Find somebody else who will listen to you. After all, you are paying them, right? Now, the other tip that I always tell our clients is, before you go into, and this is, from one of our initiatives, which is how to communicate with your primary care physician, right? We tell our clients that before you go into visit your physician, make sure you've written down questions, because a lot of times when you show up, you don't have time. Think about, how many patients they are scheduling every 10 minutes. And by the time the physician comes in, it's time to get out, right? So I always tell our clients that make sure that, you have your questions written down, any type of concern. Look at the reports, some of your reports from the previous visits, what you're not comfortable with, or what you've read, or any other concern. Write those questions down so that by the time you get there, you tell the nurse who's attending to you that I have a few questions for the physician. So by the time he or she gets into the room, you're able to ask those questions. But people are all afraid to ask those questions. I've had the same PCP for the last 22 years. Now, I won't tell you how old I am. For the last 22 years, I ask questions. And every time I get in there, I'm like, so Anita, so what's going on today? And all these questions, because I want to know. I want to protect myself, take care of myself, and also pass that out to my family. So I think it's very important to really understand that. And if the doctor, it doesn't work for you, find somebody else. Find somebody else. And that's why we're here. And that's why we're having this conversation. Now, going on to the cultural competency, that's a big one. That is a huge one. Cultural competence is where also we thrive, and Chelsey, you can, chime in at any time. And I think, with the changing populations that we see around us, the people from different backgrounds, different ethnicities, and with that also comes with different types of lifestyles, these different types of health beliefs. So it is also very good or ideal for providers to understand some of these cultural values, norms, beliefs that people come with, and I like to use, our capital region here, the Maryland, DC, Virginia, where we are. We are what I call the mixing bowl over all kinds of ethnicities, So we have people from all over the world. So with the different ethnicities comes what? Different cultural beliefs, different health beliefs, lifestyles, right? So if we are to engage or re-engage our providers, that's where the cultural competencies really come in. So our providers can understand that, this is how we need to take care of these clients. And when you look at some of the statistics, especially the 2020 census, right, that actually indicate that 46% of the people answered being from multicultural backgrounds, right? That means that within a household, there are people who identify being, with two different cultural backgrounds. So that means two different health beliefs, right? So with that, then you move forward by the year 2050, right? You'll find that providers would actually be scrambling to get on board to really understand how to take care of people who identify with different cultural backgrounds. Yeah, Chelsey.
I'll say it again, it's that relatability. We all want to feel like when we're talking to somebody, they're listening. And that also, if we see a doctor that we know is looking at us for who we are, not trying to discriminate already by what we look like walking in, I mean, you can feel that. You want to see a doctor's face and look at you in the face and say, hi, how can I help you? You want to be able to feel that connection instantly. Doctors are just like, I wouldn't say as close as a family member, but they know all your stuff. They're going to know all your business. So you have to be able to, like Anita said, ask those questions. Don't get nervous about them. Ask those questions you want to know, but then you want their response to be genuine and concerned, and you want them to care. We all want to feel that feeling of care when you go into a doctor, because you're scared anyway, because maybe you're going in there because you don't feel right? So that relatability piece, and just having a doctor that understands your cultural differences, maybe from their other patients, it's huge. It's a huge component to feel accepted when you go into a doctor's office. No one wants to feel like they don't belong there.
That is true. There's this also white coat syndrome that we hear all the time, that, the doctor knows the best. And what I always tell clients, and a doctor is also a human being, because if you didn't give the doctor all the information about you, now, how do you think they would come up with these medical records about you? So it's always a good idea to talk about everything, mostly the history about yourself. Communicate that with a doctor and see how they can help you. And again, that also helps with their competences, if you are able to communicate. Now, let's talk about a little bit of some of the other barriers actually that tie into the competencies. I find that, non-English speakers also are at risk of dying prematurely, from heart disease, because of the language barrier. And what we have done here is we are re-engaging providers actually who speak more than two languages, more than one language, I should say, two languages. Now, three languages, that's even better, right? Because a lot of people would rather have to communicate in a language that they grew up speaking. Although these days it's more than important to also have the English language as the primary language. However, it's very important to have a physician also to understand language barrier ties into the competencies of providers and how that person is going to be taken care of. There's so many other barriers that are tying to that. All right. So do you want to check the chat, Alexa, to see if there are any questions? Because I see something in there.
We did have a chat about patients needing to know their right, and that they should ask their doctors reasons why they're taking medication before just
yeah, that's a very good question. And I'll tell you, my neighborhood pharmacy knows me very well. Yeah, they know me very well, because every medication that I've ever been given, I ask questions. I ask questions. Yes, patients have the right to know that. So whatever you're being prescribed to, make sure you ask questions. You have to ask those questions. Now, again, coming back to the white coat syndrome, whereby, the doctor comes in, they write a prescription, you walk away, you don't ask questions. That's human. But because we're talking about your rights, patient's right, you have the right to know what you're taking and how that affects you. And interesting enough, a couple of years ago, my youngest son, had an incident at school. He played sports, and he ended up in a hospital, for about 7 days. So I remember being sitting there, and because he was above 18, actually he was 18, right, just 18, sitting there, and the attending physician comes in because my son was in so much pain. They prescribed a narcotic for the pain. And I sat there and said, wait a minute, and now I hear all these addiction and all that. But I am also knowledgeable, and I am an advocate. I am an educator when it comes to all these drugs that are easily addictive. So then I mentioned to the provider that does the hospital have a program where they actually educate clients on or patients on the danger of addiction to narcotics? He didn't respond. So he probably wanted to know, where is she coming from? Why is she asking me? Well, I'm the parent. I need to know. So what I was trying to do is to exercise my right, but also protect my child, that I know you're in pain and this will take your pain away. However, let's try another alternative. You can take this now, but hopefully in the next 4 hours, when they come back to the rotation, you won't be taking it, because I know the dangers of, addiction. So yes, patients have the right to ask, but unfortunately, a lot of patients don't ask. That's why we are where we are now, because of not knowing what the rights are, patients' rights are. Yeah. Chelsey, do you have any other comments on that? No.
I will say this, talking about over medication. So my mom, who I adore dearly, she was diagnosed with diabetes last year. And before that, she was having some other health issues. And I had no idea, obviously, because she was trying to hide it from me, how many medications she was supposed to be taking for the diabetes. But it wasn't even the diabetes, it was something else. But she was so overwhelmed when she went into the doctor. And of course, I have a twin brother. He started going to the doctor with her because she was so overwhelmed, and she loved her doctor. She has a new doctor now, though. But she loved her doctor and trusted that everything that she was prescribing was on point. Well, it wasn't. So my sister-in-law is a nurse for the Mayo Clinic up north. And we had called her and said, Mom is taking this. She said, she's over-medicated. It's doing the opposite of what it's supposed to be doing. So like Anita said, ask what you're taking. And my mom, bless her heart, she was on it for a little bit, and then it just got too much. And she just trusted, I'm supposed to take this in the morning and this in the afternoon. Well, the medications were counteracting each other, so they weren't even working. So she was ingesting 2 or 3 pills a day that she didn't even need to take. So ask, and she felt, obviously she felt really bad for not doing that. But, sometimes it can be overwhelming. So now she takes my brother with her every time she goes to an appointment. And he's asking. If she's not asking, somebody's asking. It's okay to have somebody to advocate for you, because sometimes it can be overwhelming, especially if there's things that are going on that you don't know about. So I will say, like Anita, I'll say that 100%. Ask why they're giving it to you, what it is for. Yeah.
Definitely, overly being over medicated. That's one of also the biggest problems that we find. There's no reason why. I mean, of course, there are people who need, more medication so that to control whatever the situation is. But still, asking the question is number one. It's a priority, and it's a patient's right as well. That's a great question. A great question. Do we have any more questions before we move on, Alexa?
Everything else in the chat was from a previous slide, so I don't think there's no questions, just comments.
All right. So let's move on to the next slide. Okay.
I don't know if you mentioned this earlier, Dr. Mwalui, but there is a statistic that a person dies every 34 seconds from cardiovascular disease. So why don't we talk about that and how that may affect women of color and heart disease?
Well, yes, I did mention that, every 34 seconds, somebody dies from heart disease, unfortunately. But of course, only about 36% of African-American women are aware that heart disease is their greatest risk factors. And we talked about that because you know what? The not understanding or not being able to differentiate between a symptom and a sign. Because a lot of times, I may experience some kind of chest discomfort and associate it with something else. Oh, and it happens all the time. Or maybe I lifted something that I shouldn't have lifted, right? But what we tell our clients is a pain that persists for a certain period of time, you have to check it out. Scientifically, 2 weeks, right? But if this goes on for a long time, and I have a story to share, check it out. Now, interesting enough, one of my neighbors across the street, they had just moved in. Then 2 years later, they moved out. Then one day when I saw the wife, we, as a nosy, not trying to be a nosy neighbor, but I was curious why they were selling the house after only 2 years. And then he proceeds to tell me that the husband was cutting grass, right, mowing the lawn, and he experienced some kind of a discomfort. And he's a young guy, pretty young guy. He experienced some kind of a discomfort. But then he never paid attention to it. So, he thought maybe I should sit down and, it will go away. So a couple hours later, he went and finished mowing the grass and things were okay. But then the following week, right, the same pain came back. But this time, they ended up going to, check it out to they ended up going to their primary care physician. They found out if that guy hadn't gone that day, he'll be dead. He ended up having quadruple bypass. So that's why, when we look at the statistics, they're real because, from the outside, we're okay, right? But until you exhibit with these pains that, come and go, and which we don't pay attention to because, we have busy lives. We have a lot of competing priorities as humans, right? But anyhow, so, and you'll find that a little over 50% of African-American women are also aware of symptoms of heart disease. And, what's interesting about that, I attended a conference many years ago. This was before the pandemic. And one of the presenters mentioned that which is also a myth. A lot of times we always think that the more educated someone is, the more they are aware. But that's not true. We have also found that even women who have higher education, who are, who exercise every single day, right? They're not aware of these things. And it's very unfortunate that it's until something happens, then people start reacting. So, yeah. Ms. Chelsey, you have something to add?
Yeah, I do agree with that. It's kind of like a falsity thinking that I eat healthy, I work out all the time, I'm good to go. But, there's also things you need to think about your weight, how your weight fluctuates, because that has a lot of bearing on your heart. So let's say you've always been in really good shape and then you gained 15 to 20 pounds. The heart takes a huge impact on that, right? So just the fluctuation with your weight as well. But if you can do your annual checkups once a year, yes, things can still pop up, but you have more of a base guideline of where your health should be and where you are, especially with your weight and your cholesterol and your glucose levels and all of that. Everything kind of can stay in that ground. And then so if you go in the next year and it's up, or if it's down, then you can kind of wave it. But a year is a good little indicator. That's why they always have you go to your annuals. But I do agree with that. Sometimes we think, oh, we're good. We're feeling good. We're good. It's always good to check in because you never know. Like I said, that genetic component can be there and it can be ready to be triggered at any time. So just awareness, but also really listening to your body too is a big deal.
Yeah, I think that's the key, listening to your body. If your body tells you something ain't right, that's the time to take some kind of actions. All right, so we are next slide. So Alexa.
Yeah, audience members, keep putting things in the chat, comments, questions, and I guess just knowing the timeline of women and heart disease, what can the public and physicians do to help bring awareness to this health topic?
There's a lot here to unpack, which we've also highlighted on. The one thing is, the advocacy, as communities, as educators, advocacy has to continue. We live in a time whereby, especially after the pandemic, that life is so precious, right? So we have to pay attention to this thing. So how can we advocate for more women, and specifically women of color, for this type of issue? Is to continue educating. That's also another way of advocacy. Educate women, and at the same time within families, right? It should be a whole family initiative. Let's take it on. Just like, we can talk about anything else. Let's talk about heart disease, knowing that is one of the leading causes of premature death, right? We've had the statistics. We know what the data are. We have to continue doing this work, right? And also, when we also think about, and that will come later, our environments where we live, right, has a lot that is tied into that, how to help bring the awareness to this topic. Later we'll talk about the social determinants of health. But maybe we should move on and talk about that as well. And that's where we are. So Miss Chelsey, do you want to lead this?
Sure, I kind of touched on it a little bit earlier. So when you talk about your modifiable risk, we have all these things here. So you're talking about behavior, okay? You're talking about your environment. So obviously what you are doing each day, okay? You're choosing healthy foods. You're trying to make the best choice of drinking water, more water, and healthier things that go inside your body. You're going to your physician regularly. These are things that adding them into your lifestyle. So it is a lifestyle, right? Not trying to disrupt your whole life, but it can be a nice complement to a longevity in your life. And then also, the physical activity component, that's in everything. Walking down the hall, walking around the mall, walking from the grocery store to your parking lot, that's physical activity, but mindfully doing it, right? Knowing that you're going to get a benefit from it. And then also managing your stress. I have my yoga mats behind me, but just ways like that to decompress, because like Anita was saying earlier, whether it's your weight or whether it's you're so busy and you don't take that time to just do a nice brain break or something to decompress you, all those are factors that hurt your heart and can make it stressed, right? And make it not function how it's supposed to. So these are all modifiable risks. These are all things that we can somewhat control. Yeah, you can control what you put in your mouth, how much you move each day. And even if you have mobility issues, you can do chair exercises. There's things that you can do, but you can also take moments in your day to breathe and relax. If you have a stressful life, you can take moments in your day to just kind of tone it down and get yourself right, because all those make you not feel your best, right? Then you talk about the non-modifiable, and that would be your genetic component. Okay, so how we were talking about earlier, it's there in us, right? Those genetics, we love them, and sometimes we're like, why? But they're there, they're a part of us. But it's how do we not trigger those to turn into a negative direction, right? If we don't put the right things in our bodies, if we are not educated and get the right information from a physician or from resources, if we are sedentary, and if we just go 1,000 miles a day all the time and don't take that time, those things will tick off that genetic component in us, and then it goes the opposite way than we want it to. So just trying to have a balanced approach to how our behavior is with our body, how how we are in our environment. Are we walking outside? Is our environment okay to walk in? Right? These are factors that we do deal with. Are we able to afford healthy foods to put in our body? Right? Can we go to the doctor? Can we afford the doctor? Right? So I get it. I get why these modifiable risks are hard at times, right? Depending on what your economic stature is and what your surroundings and your environmental are. So there are reasons why those genetic components in our body are triggered in a negative way. And then we have all these things that come up: heart disease, high blood pressure. You know, life can be really difficult, but the balanced approach, you know, and the effort to try is a big deal. It can go a long ways.
Yep. I mean, well said, Chelsea. And what I would say is, the balancing act. Again, echoing on what you just said, the balancing act is going to be key. We already know, as you said, we already know what's modifiable, what's not modifiable. Genetics are not modifiable. Our families are here to stay, right? However, there are those things, that we can work on. Chelsea, you well said, what we put in our mouth, it's key, number one key, to really understand that. Exercise, it's still beginning of the year. Most people that I know, it's a New Year's resolution. So now I'm just waiting for when that's going to end. The New Year's resolution, everybody, and going to the gym, trying to lose weight, and then the summer comes, I gotta lose weight for the summer, right? So, and we don't want to put too much pressure, especially when it comes to weight loss. Take your time. What works for you may not necessarily work for somebody else. So trying to really work within what you have. And again, we'll talk about maybe we should move on to the next slide, which is the social determinants of health. That's where I know the modifiable, the non-modifiable ones, and the social determinants, it's all a mixing bowl. So with the social determinants of health, there's a lot to do with this. For those who are, and we have quite a few students on the platform, and those who are watching us from our live stream, pay attention to the social determinants of health. These things are real. They are real. They really indeed affect us. One of the biggest ones, actually, all of them have similar impacts on health outcomes. Food deserts. And that's where you find that people will eat whatever they put their hands on, because they don't have the type of foods that are needed to actually help or improve their health. We find that. So is it something we can control? Well, yes and no. No being that, if our social economics cannot enable us or cannot enable us to purchase the foods that are good for us, then definitely we're going to be there'll be consequences in the long term, right? So again, feel free to put some of your comments in the chat so we can have this discussion, because with the social determinants of health, this is a big conversation, and it's different from region to region. I will tell you that depending on where you are, like here in the DC, Virginia, Maryland, it's very expensive to live here. So if you think about, what it costs for rent or mortgage, think about what about the food. So, we find that people are coming to make choices. Do I eat? Do I pay rent? Do I go to the doctor? What do I do? Right? There's also the issue of safety. If we are going to exercise, if let's say you can afford a gym membership, which I always tell our clients that, listen, nobody pays for walking outside, but make sure you walk during the day. But these days, with the rising rates of crime, we also have to be aware of our own safety, our neighborhood safety. So that's also an issue that impacts people from, not really exercising or being out when they should be out, right? Chelsea?
You know, I know this was a quote from, I'm not sure who it is. Maybe somebody would know. I'm not going to do it verbatim.
Yeah.
But to always try your best, you know, in whatever situation you're given. But when you know better, do better. Right. So the education about all of these items that Anita was talking about is key, right? So there are a lot of limiting factors for some, and like different regions are, you know, everybody deals with that. But let's say you can't walk outside if your neighborhood isn't safe. You can walk inside your place. It may be boring for a little bit, but if you're dealing with a health crisis and you know you need to get your blood pressure down or your heart rate's not being activated enough, walk in place for 30 minutes, put some headsets on. Find those other ways to help you keep moving forward, right? It's so easy to be stagnant, especially it's also easy, and this may sound a bit harsh, but it's easy to sometimes make excuses, right? And we're all guilty of that, right? It's true. We're human. We are human. We're flawed. It's how it works. But when your health is on the line and when you really need to make those different choices, find those ways that that you can keep moving forward. Maybe if food is too expensive, maybe drink a little bit more water. You know, maybe if you only have a certain amount of food that you have to buy, maybe eat a portion size, a smaller. You know, there are small baby steps. We're not trying to change it all in one day, right? So baby steps and just being aware of what your body is asking of you always tune into self, right? Because you know how you feel. Yeah. And you know what your body can do each day. You know what your economic situation can maybe add extra stress or not. So if there's ways to help relieve that, even if you have a stressful situation at work, come home, give yourself 5 minutes to decompress. You may not be able to change your job force, work, and how it feels in the climate of your job, but you may be able to handle how you deal with it internally. So it's just, again, I come back to that balancing act, and awareness is key. When you know better, do better. Yeah, for yourself, not for anyone else, right? For you, if you're just talking about your heart disease or your, I guess, health situations that you're dealing with.
Yeah. And that's why, I love where the space that we're in, for our non-profit or CBO and all other our partners, that we are actually, in this health equity resource committee, right? And what we do here is we have a coordinated care, really understand the social determinants of health, how that impacts health outcomes for our communities that we serve. And the other thing is, with the hospitals within our, environment here, they also have community health departments that are coordinating care and activities with CBOs to help that, right? So it depends on you as a human being. Do you really want to, do you want to continue, do you want to look at this and figure out how to take care of yourself? What do you really want? And I know that it's sometimes things are hard, especially the socioeconomic factor. Things are hard, but there are always resources out there. But anyway, let's move on because we're running out of time. All right. So I guess this is one of our last. All right, Miss Alexa. Don't forget, there's a question in the chat.
Yes, there's a comment. The comment says people push their health to the end because they have work, and some people reach for help when everything gets worse. So that's commenting back on what you guys were just discussing.
Yeah, that is very true. I think, with that, there's a phrase, competing priorities, because we have a lot of competing priorities. What comes first? And that's one of the hardest things. And that's why I love, the coaching industry, that maybe we should have, Chelsey, we should have a segment on that, the coaching overall, which is, people don't think about that, but, to how do we equip communities, with a prioritization when it comes to their own health? Yes, a lot of people put things to the very end until things happen. Okay, let's move on. So Alexa?
Yeah, my final point is on COVID-19. So what do you guys believe has been the biggest effect of COVID and heart disease?
I'm going to say, one thing, then I'll let Chelsey, wrap it up. COVID-19 has opened up a lot of worms, like a can of worms. It opened up a lot of worms. We knew some of these things existed, but unfortunately with COVID-19, we actually saw that, oh my God, biases really do exist, right? People are dying from heart disease. So, there's a lot. And, with that, I won't go in depth. However, there's a lot of literature that, people can go and read. And also the doctors now are well equipped with a lot of literature in the offices, that will ask you all kinds of questions, especially with the long COVIDs, the long COVID effects, people who have had COVID over and over. There's a lot of, information about that. Chelsey?
Yeah, I'll just briefly share, like Anita was saying, the long-term COVID effects, like they're saying that, especially the heart, we go right back to the heart, our energy center right there. They're saying that they're finding tachycardia, which is like a rapid heart rate, right? So if you know that you're experiencing that and something's not right, you get lightheaded, that could be, if you had COVID, that could be a sign, yeah, or a symptom. Yeah, a symptom that you're dealing with. You can also have myocarditis, which is inflammation of the heart, which makes you feel fatigued, right? So these are symptoms that you could be having from the effects of COVID. These are written, these are known to be happening, and they're finding all these other different things. Obviously, the anxiety and depression is through the roof, because for whatever this virus has done, whether it affected us mentally, whether we lost people, whether we're afraid of getting the virus, whether we had the virus and our body was trying to be on overdrive, like fight or flight, it sent everything into kind of like a chaos, right? Because our bodies weren't used to this. So the virus did make a big impact on a lot of different determinants. And I know a lot of people are still dealing with it. COVID is still out there. It's not going away anytime soon. But preventative, if you were okay with getting the shot or just taking the test and knowing that if you do have it, you stay home, you take care of yourself, which also helps other people as well. Or you go to the doctor and you say, I had COVID a month ago. My heart is not feeling the same. Can you help me? Right? It's just that preventative care. And now that we know COVID really did make a bigger impact, and we're going to find out things from years from now about what it did and what effects it's having on people.
Yep. And that's one of the things that, is highly highlighted in the field of public health, that we are yet to see more. We know we've seen the statistics, but we are yet to see, what are those long-term effects. Now, of course, heart disease being for some being a pre-existing condition, because there are a lot of people that had all these pre-existing conditions now, plus the COVID, it really made things even worse. So that's why it's always a good idea to have conversations with your primary care physician and, share some of the things that, are really of concern. And that's what we always advocate as advocates, as educators. What is that line of communication? What are you sharing? Because if we do not share with our physicians, what our concerns are, they won't get help. Now, before we wrap it up, I always also tell our clients that the underutilized healthcare provider is your neighborhood pharmacist. I mean, you can ask them any question, they will answer question. And the good thing about that, you don't even have to make an appointment, right? You don't have to make an appointment with your CVS pharmacist or your Walmart pharmacist, wherever you go to refill your medication. Ask them questions. They will give you great, good answers without even having an appointment. And you don't even have to pay a co-payment for that. Going to your neighborhood pharmacy. So, yeah. But other than that, Miss Alexa, you've done such a wonderful job. So for those who are here and those who are watching us on live stream, Miss Alexa is one of our student interns from University of Maryland School of Public Health. So she's the person behind these slides. And thank you, Miss Alexa, for putting all this together. And hopefully you can join us next week, which will be heart disease and mental health. Oh my God, what a combination. But yeah, we're looking forward for that. But thank you so much, Miss Chelsey, for joining us. Thank you. And we'll see you again next week. Have a good afternoon, folks. Thank you.
Bye.
Bye-bye. Bye.